So in controlling costs, when you talk about a public option, I think what that does is kind of level the playing field, so that, not that the government has to take over healthcare, but that there is an entity that competes with the insurance companies, that provides the same kind of care that the insurance companies provide for. After all, the insurance companies are only middlemen. They're just handling your money. They're not giving you any service. They take your money, your premiums every month, and when it comes around to an illness that you have, they decide what you're going to get paid for and what you're not going to get paid for. They're also going to decide whether they're going to even let you stay on their insurance plan. They may not like the fact that you're very ill and you have a lifelong, so, like say something like Lou Gehrig's disease, which is, it just goes on and it's very expensive. So they can say no, they don't want to do that. Another fact that I came up on the internet was that 45,000 people this year will die because they have no insurance, or when they finally get to some kind of healthcare facility, it's too late because they haven't been able to go to the doctor and find out what was wrong, and then it's just too late. And then that's when they see me. 700,000 people will go bankrupt this year because of hospital bills that they have to pay out of pocket. They lose their houses, they lose their jobs, so these are pretty sad statements on our nation when we are, I believe, 39th in all of the countries in the world in providing care. We're 39th in the quality of care and the outcomes of care. In other words, our babies die a lot more than babies in England, Canada, France. There are just so many inequities in the insurance companies, and if we don't level the playing field, we are going to be paying 50% of our incomes to health care. I think I have one other thing that just kind of blew my mind when I came across this particular, was just the amount of money that the United Health Group CEO made, $124.8 million in 2005. Aetna CEO John Rowe made $22.1 million, and it goes on. And so when you're paying your insurance bills, every out of $3, $1 is going to you, $2 is going for corporate jets and CEOs and what they call overhead. So if we don't get a level playing field, there is no way to pay for this. We need a level playing field. We need people to have access, and we need them to be able to afford it. It doesn't mean we want to give it away free, and we certainly don't want to give it away free to people who aren't citizens. But we need to have a level playing field so that the insurance companies can still, even if we had an option, a public option, the insurance company would still make tons of money because they'd have like 4 million more customers. So they're not gonna go broke. Have you, in all of this horrible recession that we've had, have you heard of any health insurance companies going broke? Have any of them, failed? Any of the insurance companies? I don't think I can give you the answer to that, and the answer is no. The insurance companies are doing great. So I just think that we have to look at a level playing field for we all need insurance, and that's a given. We're the only country in the world that doesn't provide insurance for everybody. Every other country in the world does.
Could we? I think we need to get to another question, perhaps. I'm going to use the subject of cost just to kind of blow through some questions here and throw out some of my opinions as well. And just on, it's incredibly, healthcare delivery is incredibly expensive for many different reasons, so I'm just going to kind of bullet point some. So one of the questions was, what are some things I don't agree about in the proposed legislation? And one big, huge issue I don't agree is basically giving the drug companies giveaways. It seems to me a no-brainer that we should be able, as a huge purchaser as a country of medicines for Medicare, Medicaid, everything else, to negotiate prices. I mean, that even seems capitalistic. So the fact that that's not a part of the current legislation just, again, to me demonstrates the power of big corporate pharmaceutical lobbyists. And, full disclosure, they buy us lunch 1-2 times, a day. It's ridiculous the amount of money. Another question about ads on television. We're one of 2 countries that allow these millions of dollars to go towards television advertising. They tell us we need 4 years of medical school and pharmacology training to get the authority to write prescriptions, and yet they're just sort of marketing these to the general population. So that's a big issue of contention with me is the drug prices. Difficult topic, lifestyle issues. A ton, these are generic terms. We spend a lot of money on lifestyle preventable illnesses and disease. And while it's a slippery slope, I'm not necessarily advocating for this model, but certainly life insurance, car insurance, is variable depending upon if you want to drive the sports car or the big sedan. And if you want to buy your life insurance and smoke and not smoke. And I don't know how we would ever arrive on this issue, but I think we as a country need to realize that a lot of our healthcare are self-induced and take some type of responsibility for taking care of ourselves, if not for ourselves, for the better whole of everybody else, because we are spending ourselves into the ground trying to fix problems that are preventable on the cheap with lifestyle issues. And that kind of segues into patient involvement. It's amazing how fewer visits we'll see in say a Medicare or Medicaid population when there is a $3 copay and there's not a $3 copay. Someone will fill a 15-minute time slot for a sniffly nose when they can bring their child in for free, but just ask them for $3, when they come in the door, and they're willing to, try them for another day or 2 on the Tylenol at home. I know we have, in our office, recently switched to health savings account, and even though I'm in the middle of all this and I know it, it really makes you think twice when you're on the hook for the first $5,000 of your medical expenses. Do I really need this? Is there another way to go? Hey doc, is there a generic for this? Can I wait this out? Can I bypass the ER and just talk to my doctor's office and get an x-ray? If we don't have patient involvement, if we don't have people realizing the cost of the care that we're delivering, we're not going to rein in control. I think a lot of the drug companies and the other people have gotten away with this because people have no idea how much this stuff costs. And I guess clarity is another thing. You go into the hospital and you get this extraordinary bill, and that may or may not be, that may have nothing to do with what the insurance company is actually paying the hospital for that. So there's just all these sort of levels of obscurity, and I think if we could have people be more aware of what the costs of healthcare are, to take their own personal controls. The HMOs, and there's some questions here about those, that's kind of sort of a third party trying to administer those costs, but I really think it's most efficient if it's the person that's seeking the healthcare who is the one that is managing the costs and on the hook for some money. So I'm certainly in favor of anything that puts a little bit of the pull out of people's own pocket, because they tend to manage the healthcare dollars a lot more efficiently that way. Malpractice, physicians are very vocal about malpractice, and I think it's more of a personal thing. It's probably, from a malpractice premium standpoint, not a huge piece, but it is a piece of some of the expensive costs. Defensive medicine, I think, personally, is very hard to quantify, and those costs, I think, are really hidden. But as part of that, too, is, I think, the realization that everybody dies. Doctors are not gods, and I'm not talking about gross negligence, but I think there's a sort of expectation, and I think the lawsuit culture sort of advances that every time you go into the hospital, they can fix you, and you can come out as good or better than when you went in, or you shouldn't have to suffer, or people don't get debilitating illnesses. And in a way, that's part of this defensive medicine attitude that we have, this sort of